Hello, my name is Elizabeth and this is Miss Evodia. She's going to be my patient for tonight. Before I start assessing her, I'm going to wash my hands for the alcohol dry wash. I've, uh, I've got her vital signs. Her temp is 98.2. Her blood pressure is 112/78. Her pulse is 82. Her height is 5'3", 5 feet 3 inches. Her weight is 140 pounds and respirations are 18 and non-labor. I grab my tools. As far as her level of consciousness, she's alert and oriented. She's her eyes are spontaneously open, and she does respond to verbal stimuli. So her Glasgow Coma scale is 15. I'll start from her head and proceed downwards. Just observing her head, it looks round. I don't see any bumps or lesions or scars or wounds. Her hair is dark and I don't see any hair loss. And I'm going to observe the skin on her face. It's dry, dark complexion, and I don't see any moisture. And her facial, can you smile for me, please? Her smile is equal on both sides, bilaterally equal. I don't observe any facial drooping. There's no drainage from her eyes. And now I'm going to palpate her head. Feel for any bumps or lesions or swelling. There's no swelling that I can feel. Her hair is dry, it's not moist to touch. And her skin is dry as well. I don't see any moisture. Feel for the temperature. It's warm, her skin is warm. And the color is uniform on each side. I'm going to test her skin turgor. Thank you. It's elastic. There's no tenting. Her skin does not appear loose. It appears to be well nourished. When you look at her nail beds, I'll observe that her hand is warm to touch. Her nail beds are pink. Capillary refill is less than 2 seconds. The shape of her nails, there's no spooning or it's not flattened, and there's no hardening observed. And the nails are well kept and clean. I'm going to observe her neck. I'm going to test her range of motion. Can you move your to left and right, please? front and back. Do you feel any pain when you do that?
No.
So her range of motion on her neck is normal. There's no pain or resistance or stiffness when she moves her neck. I'm going to look at the skin on her neck. There's no swelling observed, no lesions or bumps that I can see. I'm going to palpate the neck, feel for any lumps. There are no lumps that I can feel. Okay, I'm going to look at her ears. I'll just observe the tragus of her ears. There's no drainage that I can see. Drainage sometimes occurs with like an ear infection. No drainage on the left ear as well. Is that painful?
No.
Her tragus is normal. There's no pain when I touch it or palpate it. When I look at your eyes, observe your eyes. The pupils are round and equal bilaterally. There's no drainage observed, and the sclera, her sclera is clear. There's no hemorrhage or jaundice that I can see. Let's see, I'm going to observe her nose. The nerves are patent on both sides. There's no drainage observed, and no lesions or bumps on the outer side of her nose. Her lips are moist, they're not cracked, no lesions or bumps observed, no swelling. The throat is fine, there's no swelling observed. I'm going to palpate her lymph nodes. Normally, I shouldn't be able to feel your lymph nodes unless you have an active infection. I couldn't palpate any of her lymph nodes. I'm going to test your TMJ. Is this joint up here? When you swallow, it moves. That's your joint that allows you to chew and swallow. So I'm going to have you swallow for me, please. Okay. Do you feel any pain, resistance?
No.
So her TMJ seems to be intact. Now I'm going to test your cranial nerves, especially the ones that pertain to your head and your face. The first one I'll test is the olfactory. The olfactory cranial nerve, that's the one for smell.
Okay.
That's the one that, if it's intact, you should be able to distinguish different smells. So I'm going to put something in my hand and have you tell me what it smells like. I'll just bring it close to your nose. You describe the smell?
Smells like alcohol.
Okay. I'm going to test your optic nerve. It's the one that allows you. That's the one for your vision, your eyes. So have you observed this? Tell me what it is.
It's white. It's a cotton.
Okay. Your vision seems to be intact. Now I'm going to test. Now there are three cranial nerves: your oculomotor, your trochlea, and your abducens. They're all involved around your eyes. They affect the way you move your eyes, left and right, up and down. So I'm going to have you follow this object as I move it. And have you not move your head, please? Just move your eyes. Thank you. Okay, I'm going to approach your eye with something. Yes, the abducens. So her cranial nerves, the trochlea, the oculomotor, and the abducens seem they're intact. Now I'm going to test your trigeminal nerve, which is around your face, how you can feel. So I'm going to have you close your eyes and tell me where you feel something touching your face. Tell me the side of your face where you feel it. Can you describe where you feel that?
On the right side of my jaw.
What kind of touch is it? Is it a deep touch or a light touch?
It's a light touch.
Okay. Did you feel that?
Yes, on the left side of my jaw is still a light touch.
Okay. Trigeminal nerve is working normally. Now I'm going to have you make facial expressions. I'm going to have you smile, frown, laugh, do act like pretend like you're chewing something. Then move your lips, your mouth from left to right. Facial nerve, your facial nerve allows you to do that, and that seems to be intact because you're able to perform those instructions without any abnormalities. Now I'm going to test your acoustic nerve. It's the one that enables you to hear. I'm going to whisper something in your ear and have you repeat it out loud. Can you repeat out loud what I whispered in your ear?
You said touch.
Okay. I'm going to test your accessory. That's the one that allows you to move your shoulders into a shrug. So I'm going to place my hands on your shoulders and have you shrug them for me.
Okay.
Okay. The movement is equal bilaterally. And I'm going to have you open your mouth up. Move your tongue back and forth, please, side to side. As the glossopharyngeal nerve controls the movement of her tongue, and it seems to be intact because she's able to move her tongue in and out, back and forth. Now I'm going to look in your mouth, just observe the skin color of your mucous membranes. Her mucous membranes are pink, moist, and as far as I can see, I don't observe any lesions or bumps or swelling. Now, I'll have you stick your tongue out so I can observe the back of your mouth. I don't observe any lumps or obstructions. Now, you put your tongue back in, please. Let me see your teeth. She's got all her teeth, and they're clean and well taken care of. Her lips are pink and no bumps or lesions observed. And I also state that there's no jaundice observed on the mucous membranes because with dark skinned people like us, jaundice may not show on our skin, it may show on our mucous membranes. So that I didn't observe any jaundice. Okay, now I'm going to this can you swallow for me? Doesn't seem to be swallowing. Okay, I'm going to test her trachea, observe her trachea, and then the thyroid gland. I'm palpating her neck. Her trachea seems to be midline, right in the middle. It doesn't seem to be deviated to either side, like in the center. Now, please swallow for me. Swallow again. Now, I was testing for the thyroid gland, like when you swallow, I can feel your thyroid, and it's not swollen, that I can feel. Okay, now, I would normally do a breast exam, but I'm not going to do that for the purpose of this video. But I'm going to do some teaching about the breast exam. It's can you tell me a little bit of what you know about breast exams, self-exams?
Yes, I was told that when a woman reaches her 40s, it's always good for them to do like a yearly check, either a yearly or a monthly checkup on their breast because they are prone to actually have like lumps which might result into cancer, which might be cancerous. So it's good to always do like a monthly checkup, like you self-examine yourself to find out if you have any abnormalities around your breast.
Okay. Okay. Yes. Oh, yes. It's good to do your breast exams monthly, and you should pick a date that is at least 7 days before your period, or at least 7 days after your period. Because when it's close to your period, your breast would have, some women at least would have like, they'll feel that their breasts are lumpy, but that's just from the hormones that your body secretes during your period. So if you were to do an exam in the close to your period, you would think that you have lumps on your breast, but you really may not have lumps. And when you do an exam, the best time to do it is when you get out of the shower, when your skin is still soft and supple. Then you can stand sideways in front of the mirror. You raise your arms. When you move your arm up, your breast tissue moves with your arm. So you can start especially at this angle, because this is where the most lumps that are found in women are usually found around the axillary underarm region. So you observe that, you palpate, you do like a circular motion, and if you feel anything solid, you need to report that to your primary care provider. And also, like if you move your tissue and if there's a lump, the lump is not going to move with the tissue, the lump will stay put. And you do the same for the other side. Then you do circular motions around your breast tissue and feel for any abnormalities. And also observe the skin on your breast, because your some cancers or lumps may present such that the skin looks like an orange peel, and they usually call them peau orange. So if you see your skin around your breast start to change and looks like an orange peel, that's a cause for concern, and you should report that to your healthcare provider for further evaluation. And another thing, on your nipples,
Mhm.
squeeze them in the base, see if there's any discharge from the nipples, because some cancers may produce discharge, and observe the consistency and color and smell of whatever you get out of your breast.
Okay.
Okay, so that's that. Now I'm going to do a respiratory assessment, and I'll start by observing your chest wall. You don't need to puff out your chest. Just observe how you breathe. Take a deep breath. I observe that her chest rise and fall is equal bilaterally. The skin on her chest is dry, not in a bad way. There's no moisture observed. In temperature, it's warm. Now observe behind. You take a deep breath for me, please. There's bilaterally equal chest rise on the back posterior area. When she breathes in, the muscles they rise at an equal rate, and her respirations are not labored. She does not appear to be in any respiratory distress. I'm going to listen to your lungs. Listen to the back and the side of it. Would you take off your jacket for me, please? Thank you. Her lungs are clear. Her anterior lung fields are clear to auscultation. The posterior lung fields are clear to auscultation. I didn't hear any rails or crackles or rhonchi. She doesn't have a cough. And the breath sounds are clear on the upper and lower lung fields. And now I'm going to do a cardiovascular assessment, and I'll listen to your heart. her head sounds, I can hear her S1 and S2. I don't hear any third head sound, and her rate, the apical rate is regular. I'm going to check your pulse. I'm going to listen to your carotid pulse. Now this pulse right here. I'm sorry, I missed something. As far as your heart rate is concerned, I did not hear a murmur. Some people have heart murmurs. Some heart murmurs are benign, but others could be a sign of heart disease. But I didn't hear any heart murmur when I listened to your heart. I'm going to listen to your carotid pulse. It's a pulse that uh, carries blood to and from the blood vessel that transports blood to your brain. And some people have like a bruit. It's like a rough sound, and that usually means that the blood vessel is like narrowed, and the heart is having to pump fast, much harder to uh, transport blood to the brain, and that also could uh, mean that the person may be at risk for a stroke if that blood vessel is narrowed. That's going to palpate pulse. Listen to that pulse. Listen on this side. Yes, I did not hear any brewing. And one thing to note with this carotid arteries is like you can you cannot manually handle both at the same time, because if somebody has an obstruction in one and you occlude both vessels, that could stop the oxygen flow to your brain, and they could just pass out or die. Okay, I'm gonna palpate your pulses. Temporal pulse. It's also it's one of the vessels that transports blood to your brain, to and from your brain. Okay, feel it. It's palpable and it's regular. And I'm going to palpate the brachial pulse. It's usually on your elbow areas. This is the one that's mostly used to get your blood pressure. Okay, the palpable and the regular. The radial pulses. The palpable and the irregular. The capillary refill, like I stated earlier, is under 2 seconds. Nail beds are pink. No cyanosis noted. Look at your mouth again. No cyanosis noted. Cyanosis occurs when there's a lack of oxygen supply to the tissues. They become like a bluish color. And it's mostly, you can easily see that in like Caucasian people, but with black people, you have to look in the mucous membranes to observe the cyanosis. Or some people may have it in their nail beds. You know how sometimes when you handle frozen food, your hands start looking like dark purple or blue? That's cyanosis. and her skin is warm, and you have good blood supply to your skin. And I'll check for edema. Edema is swelling, especially with fluid accumulation in the tissues. That usually signifies a heart problem. Either the heart is not, the blood is being pumped to your extremities, but it's not being brought back to your central circulation. I'm going to observe her feet. There's no edema on her feet, and it's most commonly noted on the feet because the feet are in a dependent position.
Okay.
The easiest place to observe edema is in your lower extremities, as opposed to because your hands are always moving above your heart sometimes. Okay, I'm going to palpate her pulses on her lower extremities, the popliteal pulse, the back of your knees, and the dorsalis pedis pulse, and the tibialis pulse. It's palpable and it's regular. Her tibialis pulse. It's palpable and it's regular. Her dorsalis pedis. Palpable and regular. I'm going to do same for the right leg. Her popliteal pulse is palpable and regular. Tibialis pulse is palpable and regular. And the dorsalis pedis is palpable and is regular. Oh, I'm sorry. Now I'm going to do a neurological check on you. I'm going to check your reflexes. Check your tricep reflex. Okay. Let's observe the movement in the tap. I'm going to check this one. Okay. Like that. I'm going to check on the right side. Okay. Like that. Check here. Okay. And check your patellar reflex. It's usually called a knee tap. Okay. Ready? See the move that her leg flexes when I tap her knee. Okay. The reflexes are intact. Now I'm going to put an object in your hand. I'm going to have you close your eyes first. And I put an object in your hand, I would like you for you to describe what it feels like, the texture, and can you describe that for me?
I think that this is a thing. It's hard, but it's thin.
Okay. I'm going to have you close your eyes again. I'm going to put something in your hand. You describe what it feels like.
Feels like a belly.
It's heavy.
And it's hard.
Okay. Open your eyes. Now I'm going to have you close your eyes and I'll touch your face with two objects. I want you to describe each to me. Okay, can you describe what it feels like to me?
Yeah, the first one you used was very warm and soft, very light.
And the second?
The second one was a little bit, it was hard and cold.
You can open your eyes. So she's able to distinguish a solid object from a light one, and she's able to distinguish objects based on their consistency and shape and form. That's part of your neurological assessment. And okay, I'm going to have you do some other tests that are physical, but they're part of the neurological assessment. I'd like for you to take your one finger, put it to your nose. Okay, that's good. I'll have you walk on your toes. Okay, and I'll have you do this movements. You can sit down while you do this, for instance. You can do this. Observe you do that with your hands, please.
With my toes too.
No, just your hands. Your arms will be fine. Okay, that's good. She's able to do alternating movements with no problems. Now have you raise your arms and bring them down. Raise them up again, bring them down. Now with people that, especially those that have had strokes, when they raise your arms, you may observe drifting. So your movements, there were no deficits. I'm going to test your muscle strength. I'm going to have you squeeze my hands. Okay. On bilaterally equal muscle strength and muscles her muscles normal tone, they don't look atrophied or excessively hypertrophied. Now have you lift your legs up as far up as you can go. You do that again. Okay, and have you push on my hands with your feet. Okay, her muscle strength is equal on the lower extremities, bilaterally equal. Then I'm going to have you pull on me as hard as you can. Okay. Obviously, she's a strong lady. Okay, now I'm going to do an abdominal assessment on you. I'll observe that her abdomen looks rounded. Now, round is a good thing because if you're well nourished, your abdomen would, I mean, not big, but just round. So, and for people that are malnourished, you would observe like a scaphoid stomach. Your stomach your abdomen is round. I'll observe that there's no moisture that I can see. I don't see any herniations. Now, herniations usually occur when the abdominal wall muscle is weakened and your organs move like pull push to that area. So you may observe some, like, not really a swollen area, but an area that looks a little different.
Different from the other
Right.
lungs.
But with yours, there's perfect symmetry. So I would guess that you don't have any herniations. The umbilicus is to the midline. Now I'm going to listen to your abdominal sounds. Your abdominal sounds indicate that your bowels are moving. Peristalsis is constantly moving. When you eat, they move and you move, propel whatever you eat through your digestive tract. If there is an absence of abdominal sounds, it could either be that your intestines are quote unquote sleepy, or you have a problem, maybe an obstruction somewhere. Abdominal sounds active on the right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrants. So that indicates your bowels are functioning properly. I'm going to listen to the midline. The midline of your abdomen, there's a huge blood vessel. It's an abdominal aorta, and with some people, they may have a problem where that aorta is enlarged, is dilated, and when it becomes too dilated, it may rupture, and that would be a serious cause for concern. And you could actually hear like a bruise sound if that is the case. I can't hear any brewing like sound from there, and I'm going to feel lightly because you abdomen just to get different sounds. Some people may have fluid pulled up in the stomach, and when you percuss, you could actually hear like it's like tinkling, and that would be an abnormal finding if you had fluid pulled up in the abdomen. I just observed a shallow sound. It's called timpani, and that is a normal sound for the stomach. And I'm going to palpate. I'll first start by observing that stomach is warm to touch. There's no moisture. It's good. If you feel any tenderness, please let me know. Her abdomen is soft to touch, which is good. It's a normal finding. If you were hard, that would be a cause for concern and would need to be further investigated. You feel any tenderness? No tenderness with palpation. I don't note any lumps or swellings. Now I'm going to have you stand on one foot and test your sense of balance. Okay, alternate to the other leg. Observe that she's able to do that without staggering. Your sense of balance is intact.
Okay.
That sense of balance is controlled by your cerebellum in your brain. So your cerebellum is intact. Now I'll have you turn to the side so I can observe your back profile. I'm going to lift your shirt up so I can look at your spine. And I'll have you bend like you want to touch your knees and toes. And you can come back up. Her spine is straight. There's no scoliosis or kyphosis. Scoliosis is like an S shape, like spine, and then kyphosis like a K, like kind of like curved into the middle. Then lordosis is like with pregnant women, usually kind of the sense of balance is kind of shifted because of the pregnancy. Yeah. So you don't seem to have any of those. So you seem to be fine as far as that is concerned. Okay. I think we've come to the end of the assessment. Thank you so much, Ms. Evodia, for taking part in this. I appreciate your cooperation. Hope to work with you again.
Thank you too.
Thank you.